May is Mental Health Awareness Month. Over the next few weeks, we are going to cover a range of mental health conditions. Today, we're going to talk about anxiety, and I'm pleased to be joined by Dr. Michael, who's a consultant psychiatrist and psychodynamic psychotherapist. He works at Mediclinic Middle East and Mediclinic Arabia branches. Anxiety is unpleasant feeling we get when we are faced with stressful and difficult situation. It can be as a result of everyday problems or as a result of experiencing major life events like divorce, job loss, or physical illness. We can also encounter it when we are experiencing pleasant events like starting a relationship or starting a new job or going to a job interview. Anxiety is one of the most common mental health conditions. Globally, everybody experiences anxiety at some point in their life, and certainly it is one of the most common mental health issues that we encounter in our clinics. Dr. Michael, could you tell us please when anxiety becomes a problem?
Well, I think, as you nicely said, anxiety is a normal emotion. So we all need anxiety to warn us that there's potential danger. And so I guess you could see the problem kind of anxiety being at the extreme range of that, when it becomes out of proportion or it's consuming a lot of the person's life. You know, rather than a planned worry that can be dealt with, the worry just goes over and again, or the physical symptoms can be extreme.
So anxiety can present as psychological and physical symptoms in the person.
That's right. I mean, I think if you look at anxiety, as we said, in normality, I guess, primitive man would have had to sort of fight off a threat. So we would get what's called a fight-flight response. Yeah. So it's a physical feeling where the adrenaline will be pumping to get your muscles ready, your breathing will increase, the heart rate goes up. So you're getting ready to either to have to fight something or run away from it. So it's physiologically adaptive. And all the symptoms of anxiety are that, really, especially in panic attacks. It's the extreme of anxiety where people feel, the gut feelings like the irritable bowel, the tightness in the chest, the tense muscles, the headaches. It's very much an extreme of normality that becomes problematic.
And I guess most of our patients present themselves primarily to their family medicine or the cardiologist because of these extreme physical symptoms.
Yes, I mean, I see a lot of patients who they've had a lot of investigations, and that's part of the work of helping someone to recognise that you can have physical conditions as well as anxiety overlapping.
So what's the treatment for the condition?
Well, I think it starts really with a very comprehensive assessment, because as you're saying, there can be physical conditions that overlap with anxiety, but also physical problems that cause anxiety, and particularly hormonal issues such as thyroid, or sometimes the menopause, can present as anxiety. So there's a lot of medical conditions that need to be excluded, as well as sometimes drugs that they're prescribed, or drugs such as alcohol or drugs of abuse can cause anxiety. So it's important to get a full range of assessment, as well as the psychological and social factors that contribute to it.
One of the most important therapies utilized to treat anxiety and depression is cognitive behavioral therapy, or we often refer to as CBT. Could you please tell us what is cognitive behavioural therapy?
Well, it's a therapy that particularly looks at how people's thoughts, and particularly negative thoughts, when we talk about anxiety and depression, can influence their behaviour and make them feel very stressed. So it's a form of therapy that tries to help them to think differently and to break a cycle so that they can change their way of coping with things.
And how long that will take? So how many sessions that will take?
Well, I mean, it can be done in quite brief sessions, particularly if it's quite a discrete thing. So, frightened of a spider, or, being able to go out the house. So that would be a psychologist, to try and sort of, work with the person where it's happening. If, they might be frightened of escalators or whatever. But it can be variable depending what kind of anxiety they've got. Sometimes you might need to be working over a period. And I often use 6 sessions to try and get a piece of work done.
Okay. So what you're saying are there are different modalities of treatment. Through holistic approach, we can manage the condition. And I presumably we are talking about psychological therapies as well as treatment with medication. Which one would you recommend first?
Well, I guess I suppose I'm a slightly different kind of psychiatrist. I'd be doing them simultaneously, really, because I think as part of the assessment, you are a kind of hierarchy of thinking about what physical, organic problems could be there, how the person has grown up and developed, because their background history is very important as to how they react to life stresses, and sometimes they might not necessarily be conscious of what's making them anxious, and you can spot it by looking at patterns. So I think it's not one or the other. Sometimes it can be both, and certainly I would tend to use medication if the anxiety is becoming more severe, that it would be too difficult to think about the issues without some help from medication.
Right. So what medications are available for treatment of anxiety?
Well, various, but I mean, probably the first line one would be an antidepressant, because you're hoping to maintain a treatment that would continue, once they're feeling better and through their anxiety.
And how long the patient will have to take the medication?
I mean, in combination, if they're doing talking therapies, that can be a factor too. But classically, you would be sort of expecting perhaps 6 months or more after they're feeling better, to reduce the chances of relapsing.
Okay, I got a lot of question about the medication in terms of whether it is addictive or not in my clinic. What's your take on that?
It's not thought that antidepressants are addictive, though there is obviously concern about something called discontinuation syndrome, which needs to be discussed before someone starts antidepressants, to clarify those issues.
But the discontinuation syndrome is something we could manage, I guess, fairly easily through gradual and safe reduction of the medication.
Yeah, and not having higher doses for too long a period that's unnecessary.
What could the patient himself do to help himself?
Well, I think as I say, that's why it's important to take a full history to find out, what are the various factors, because often there's quite a lot of issues that can be thought about, ranging from the lifestyle, so thinking of, exercise, relaxation, things like yoga. There's all sorts of things that can be done to help, as well as, how people might think differently about their stressors, and that's where we can help them.
Dr. Michael, thank you very much for joining us today.
Okay, thank you.